Hi, my name is Lance Parker, the Senior Advising Coordinator at UT Health Science Center at Tyler. I would like to welcome you back to the final Lunch and Learn segment. Today, I have Shelby Powell, Sandra Perez, and Misty Lewis as guests today. Today's Lunch and Learn will be an alumni panel covering career success in life after the graduate degree. The Lunch and Learn series provides engaging conversation, meaningful information to support the professional growth of students, trainees, and stakeholders. By the end of this segment, you will be able to define the importance of alumni engagement and identify key tips and strategies, bridging the gap between career success and alumni engagement. How you guys doing today?
Pretty good.
Doing
Doing
well.
great.
You guys seem a little flat. Is everyone okay?
Oh yeah.
All right.
I'm
So-
doing good.
Okay. So I want to kind of just jump straight into it because I want to take up too much of you guys' time today. And the first question I have for you guys, and I think I let Ms. Powell answer this question first, and you guys can join in after she answers it. Is what does a UT Health Science Center at Tyler alumni mean to you?
Yeah, thank you, Lance. I would say being an alumni of UT Health Science Center, it means that I'm equipped with, the right knowledge and tools that I need to lead a career in public health. It's something that I think that it was really specialized here at the hospital. I've been able to network with, the veterans, so to speak, of public and community health. And I think that's been such a great experience and really an honor to be mentored by just some of the best clinicians and leaders in this type of field.
Great. What about you, Ms. Lewis?
As for me, thank you again for this opportunity, Lance. It is something I am very proud of as being the first in my family to graduate with this degree. This is a huge accomplishment. I've been a nurse for 20 years, so I think it has just helped shape my professional identity and given me a long career in public health as well. So I'm very honored, and it's a huge accomplishment, like I said.
Ms. Perez.
Hi everybody. I'm Sandra. And so to me, being a UT Health Science Center at Tyler alumni means I'm, in this really tight-knit network of healthcare workers, varying occupations, all sides of public health, and they all provide advocacy and improve the, well-being of our community. And not only the professors, but our classmates as well. Some of them have such long careers and very successful, and some of us are just starting out, and it ranges, and we all kind of bring our own background, and it's kind of interesting to learn that along with our degree. So I really was thankful for that experience.
Awesome. I'm glad you guys had a great experience at the Health Science Center. So for my next question, I'll let Ms. Lewis answer it first. It states, how important is devoting yourself to a health solution? And what I mean by that is, I am a former healthcare professional, and I devoted my solution to mental health. So how important is it to devote yourself to a health solution?
So devoting myself to a health solution, I think it is very important. One example was when I applied for this program at the university. I have been in my current role as a lung nodule nurse navigator for a little over a year, and my job description did not require me to have a master's degree. However, I knew I wanted to grow, and so not just professionally, but it would also strengthen my nursing skills and abilities, especially as it relates to community health. I also managed the lung cancer screening program, and this degree has taught me to not only look within our patient population, but also how we can reach people in the communities who also may need assistance with not only the program that I am part of, but also access to quality health care with treating other medical conditions as well.
Ms. Perez, how important was it for you to devote yourself to a health solution?
So, especially, I think we all saw that at the start of the COVID-19 pandemic, a lot of people kind of noticed what public health was. And so it kind of allowed us to explain our degrees a little bit better. But, um, I'm currently in a position where I'm advocating for colorectal cancer screening, but it kind of changed at the start of the pandemic. And, a lot of us were volunteering our time helping the community. I was doing calls to patients that had COVID-19. Currently I'm helping out at the vaccine clinic along with a lot of other healthcare workers. We're just doing our part and kind of helping out with any kind of solution, no matter, what area specifically we're working in. So I think that's really cool how we shifted that side when the pandemic started.
Ms. Powell, how important is it for you to devote yourself to a health solution?
Yeah, I think like we've all said, it's very important for us, especially with a career in public health. You're taking the time and energy to devote yourself to the good and quality of life of other individuals, whether it's your community or your region or just within the United States. And for me specifically, it's been working with the Southwest Ag Center. And if those who are listening are not familiar with them, we promote health and safety through research or education or training for the agriculture community. And that's been just a really wonderful opportunity. And it's really changed my focus and my passion for worker health and safety has helped drive this in my work in the center. And so it's been a really great opportunity to promote health and safety and to be able to devote myself to this work. And I've worked with a lot of individuals who are resistant to, help especially when it comes to their health. But it's been really rewarding. And I think that you learn to build that trust with them like you do anyone. And, to let us in, it's been really exciting, the work that we've got to do, especially lately during COVID.
I like to point out one key factor that all you guys said is that, most of you guys said that while you were in the program, you had an idea of the health solution that you already kind of wanted to be committed to. And I think that's very important for our students to understand that while you're in the program, it's okay to not know exactly where you want to be, but find yourself while you're in the program. And I think you guys kind of mentioned that all when you gave you guys your feedback on that question. So thank you for that. My next question, I will let Ms. Perez answer. As a health science professional, what skills and characteristics are essential to one's success?
I think there's obviously so many things one can work on, but obviously, great communication skills and not only understanding, but, listening and fully comprehending what people are saying, along with, collaboration and working with others, especially at the Health Science Center. We're able to work with so many people, and there's so many intelligent professors that have huge backgrounds in different things that can help you at any kind of sort of project you're looking at. And along with, I think, constantly wanting to learn to create some sort of successful background, attending webinars, doing lunch and learn series, getting CEUs for different certifications you have. I think all of those can be essential for your success.
Love it. Anyone else want to kind of expound on that?
I'll add a point to it. Oh, go ahead.
Well, I was just going to say having a positive attitude can also go a long way. Teamwork, time management, and just having a passion for what you do.
Yeah, that's a great point, Misty. I'll also add, I think for me, it's been just humility, bringing myself into the world of professionals and those that have walked this road for many years, who have gained so much knowledge and experience. And, as I come into this, I want to make sure that I'm myself to listen to these types of people and these leaders in this work, it's really opened my mind to possibilities, as well as allowing myself to learn more than what I already knew. And I think that's helped my career professionally.
I think another element to add would be mentorships. When I got my MHA and I really didn't have a great understanding of what I could do with it, joining the mentorship program really gave me a more in-depth understanding of what a MHA was. The curriculum was great, but knowing what to do with it was a different thing. So when I got into some mentorships, it really helped. So students, get into some mentorship programs, okay?
Oh, yeah.
Yes, yes.
That would be awesome as well. I still work with some of my mentors. So yes.
I think mentorship, it never stops. Even as me being a doctoral student right now, I'm still going through the mentorship process now. Always learning new things, learning even how to do a CV a different way, formatted differently than what I've seen before as a higher education student. Now it's much different now. So I think mentorships just provide so much learning, and it can just help you with your skills and also build your professional identity in a profound way. My next question, I'll give it to Ms. Powell. Being a Health Science Center alumni, what steps did you take to ensure career success?
Well, I'll say it really worked out for me in the sense that I decided to complete my capstone here at the Southwest Ag Center. And, after building that relationship with Dr. Casanova and Amanda Wickman, I was able to kind of step into a role at the center. So outreach education coordinator. And so I wouldn't have that position, I believe, if I had not pursued this degree here at the UT Health Science Center. And so that was a really great opportunity for me to take. And I encourage other students, as they're pursuing this degree, to really make connections, network, and put yourself out there and with others in this field, because what you started out thinking you wanted, it might change down the road, especially as you try to specify this career.
Anyone else want to kind of add to that?
I would say, since I was in my role, even after I graduated, look for opportunities to grow. Be ready to learn. Education has always been my passion. So I took some of the tools that I learned when I was in the program back to my current position, and I started on a program in my that helped us to add to the implementation of a project here in the clinic as well. And so it went on to, it was tobacco use, tobacco cessation related, where we were able to add it in the template of the nurse section. And so the tools that you learn when you're in school, think of ways that you can implement those if you are going to stay in the current position at your current job that you're at. So just ways that how can I, what can I do, what projects that I can bring to the table to find solutions to problems in the current role that you're in. I think is another way. Also serve on committees if you can. Participate in any kind of advancement programs. Here for nurses, we have a clinical advancement program, and I also work with other nurses to complete that program. And so just get involved, put yourself out there, and I believe the opportunities will come to you.
Yeah, I definitely agree. I would say don't be afraid to ask, professors, if you need any assistance on anything. When you put in great work into your coursework, they'll notice that. And, in the future, if something comes up, they'll ask you to participate in different things, different conferences going on, and you can, enter in poster competitions. I've been able to co-author a manuscript with one of my professors, and I was given that chance because they knew about my time in biostatistics and, being involved in different events. I think that couldn't have been possible if, you didn't put in that work, and you just have to ask, what opportunities that are at the Health Science Center.
One thing I would like to add is professional organizations. I think that professional organizations don't get the justice that they should. When I just finished with my MHA, I was suggested by my mentor to join the American College Association of Health Executives. And once I did, I mean, of course, you had to pay a membership fee. They do have student memberships as well. But I went to their job board and I found a job like within a week or two. So that's also, I think, what should be kind of talked about more is professional organizations, because they provide great assistance as well.
Oh yeah, especially with that student rate.
Yes, the student rate is, I love the student rate, trust me. So my final question is a two-part question. I'll give it to Ms. Perez. How important or challenging was it to create or build a professional identity? And can you explain how your professional identity impacted your career opportunities?
Yeah, sure. So in undergrad, I kind of was thinking about going the clinical route where, as a nurse or physician or PA, something like that. And I just didn't really connect with the material. And that's when I was advised to go in the public health route. And I actually majored in community health in my undergrad. And it kind of showed me a different path in public health, and one that I really liked, and in the preventative realm. And I really appreciated that. And so when I was actually looking for positions, I found one at the Health Science Center, and that led me to eventually start the MPH program. So, I found my passion in public health, and which found my career, the start of my career, and it allowed me to find different ways to improve that. I've also gotten my community health worker certification, and that has also helped build my professional identity, and doing different webinars and learning more about new techniques and improving efficiency in how we work. I think that's really important, along with finding mentors, like you had said before, and looking up to my supervisor and asking him for different opportunities that I can work on, working on different manuscripts or writing a paper, things like that. I find that can help build your professional identity. I don't think it ever ends, you just continue to build it on up as you go older.
Anybody else want to try to give some feedback on that?
I think she hit it right on. Asking, for opportunities to build your professional identity is great. It's an ongoing process, of course, but make sure that you are developing a positive perception of yourself, and it is who you are and what you have to offer. And so opportunities, especially if you, I would say if you have a passion for what you are doing, and in this field, you have to have a passion. And number one, the goal has to be to help people. And so if you have a passion for that, then opportunities will come. But you have to be willing and ready for them when they do come as well.
As you guys were kind of discussing that somewhat, I thought about, like, in today's society and like with this whole COVID-19 thing that took place over the past year, you got to have a digital presence now for your professional identity. And LinkedIn is a great place to do that, but it's not easy establishing that. Am I right or wrong?
Oh, yeah. That's so true.
It's kind of difficult at sometimes, but I think with practice and just researching and continuing to, like you guys said, reach out, I think it can be done. So
yes. Digital hard. We did this past November was Lung Cancer Awareness Month. And so we had a social media campaign, which was huge. I mean, the success rate was great. And so, but it challenged us. So, you know, it just showing us that we're having to be creative in our approach with everything that we do now because of COVID. And so I just, you know, that's why it's always good to be thinking. I like the question that you asked about health solutions, you know, thinking of things that we can do, you know, one step forward. So instead, I like this little quote from Ralph Waldo Emerson. Do not go where the path may lead, go instead where there is no path and leave a trail. I think that's a great statement for any professional.
I would agree. I love that. I love that. And to the students and the view and the faculty and the staff that's listening, I think if I'm not mistaken, we did a lunch and learn with LinkedIn about building a digital presence for professional identity. So go check that out. It's a lot of great tips and strategies on that. But what an amazing lunch and learn today. And I want to say thank you to Shelby Powell, Sandra Perez, and Misty Lewis for taking the time to tell students and faculty and staff about the journey to career success as alumni at the Health Science Center. All you guys mentioned the importance of reaching out to someone, mentorships, and all those are critical parts of success for your career. So students, faculty, and staff, the tips and strategies discussed today can be applied to your career journey as well. So until next time, this is Lance Parker signing off.